Hi, lovelies. So today I wanted to talk about medicine. I'm a primary care physician, family medicine physician, and I've been for over 5 years now. And I wanted to see how I could help y'all out. So I have a lot of new patients that come in and really don't know what to do or what to say or how to prepare for their first primary care physician appointment. So today I'm going to give you 5 tips and things to do in order for you to prepare for your primary care physician visit, your first primary care physician visit, and actually any kind after that. Okay, so number one, make sure you know all your medical conditions, every single one, including your surgeries and procedures. It's very important. So if you've had C-sections before, it's important that you know that and you mention that, okay, because that is a surgery. If you had different procedures, okay, I gotta know whether it's an epidural procedure with pain management for different abnormalities with your spine. I need to know those things. Those are very important. So make sure that you rack your brain and try to recall all the procedures as well as the surgeries that you've done, okay, in the past. So number 2, make sure you know all your medications, okay? Either you know them, or if you don't, you bring a list of them. Please don't forget the over-the-counter medications as well as herbal supplements. There are a lot of over-the-counter medications as well as herbal supplements that can actually interact with different medications. So we all, as primary care physicians, need to know these things, okay? So please make sure that you are being cognizant of that and that you're letting us know. Please don't forget the over-the-counter medications. Make sure you know the doses of those as well. So over-the-counter medications as well as herbal supplements, we need to know that in addition to your prescribed medications. Number 3, we need to know your family history. So please make sure that you try to find out as much as possible. I know there's some people that it might be hard to. They might not know one parent really well, or they might be adopted. But please, please, please try to do the best you can to really find out about the medical conditions that occur in your family line. There are a lot of diseases that are genetic, that run through families. And so knowing about these things can help us potentially screen for them in order to prevent them from happening. Number 4, this is a very simple one, but I have a lot of patients that forget to do this. Please make sure that you fill out all paperwork, whether it's, online or whether it's a paper copy. Please make sure you fill them out because they actually help me as a primary care physician really prepare in advance, really make sure that I get to know you before you walk in the door. It also makes us more efficient. And so we're not scrambling to find this and that or scrambling for you to finish the form, filling out the forms. So for you to be able to fill out the forms will actually be very beneficial in our first visit. It helps you, it helps me, and it helps us connect better and listen to all your complaints. Number 5, make sure you write a problem list, especially if you have more than 2 complaints. That is key. A lot of my patients are older, and so they tend to forget different things that go on with them when they have not seen me yet. So it's essential that anytime you have a complaint or concern before the first appointment or even subsequently, make sure that you write it down on a sheet of paper, write it down in a book, write it down in a journal, write it down on a calendar, write it in your phone, type it in your phone, whatever you can do to remember it. But please make sure you bring that list to me, and then I most likely will not be able to go through over every single item in the list, but it helps me to triage and help to reassure you, as well as to discuss the other problems at a later visit. So that's very important that you know and write down a problem list in order for me to help you. So I know I told you I was going to give you 5 tips in order for you to be better prepared for your first primary care physician visit as well as subsequent ones, but I'm just going to do you a nice little favor and give you our bonus tip. Make sure you know what kind of shots you've got and when. Please, 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 that helps me help you. You have to know when your last tetanus shot is. You have to know when your last pneumonia shot is. You have to know when your last flu shot was. You have to know when your last COVID shot was. How many times you got the COVID shot? Did you get the booster? You need to know these things because that helps me help you. So if you haven't had the latest booster, I need to know. So you go ahead and get it. If you haven't had the flu shot in 10 years, I need to know. If you've never gotten, I don't know, like the RSV shot and you're over the age of 65, you got to go get it. And I got to help you get it. Because we do not want you to be in the hospital. We do not want you to be sick. We do not want you to be out of breath. But if you do not know and you cannot tell me, then I really can't help you. So please make sure that you're up to date with all your shots, one. And if you aren't, please make sure you let me know so I can help you get those shots that you actually need. Okay? All right. I hope these factors that I've given you are going to be helpful in your first primary care physician visit as well as subsequent visits. If there is anything else you want me to add with regards to any additional tips, make sure that you put it down in the comments that you want me to do another video detailing additional tips, and I will do so. Make sure you put it down in the comments. My name is Dr. Liz, aka Ohemaa Mac. I started this channel to talk about all things luxury, faith, and medicine. So please make sure that you subscribe to my channel, you like this video, and you share it with all your friends and family. Until later, bye.